ਗ੍ਰਾਹਮ ਮੈਕਗ੍ਰੈਗਰ ਜਿਹੜੇ ਸਾਡੇ ਬਰੈਂਪਟਨ ਨਾਰਥ ਤੋਂ MPP ਨੇ ਔਰ ਨਾਲ ਦੀ ਨਾਲ ਹੀ ਹੀ ਇਜ਼ ਪਾਰਲੀਮੈਂਟਰੀ ਸੈਕਟਰੀ ਟੂ Minister of Citizenship and Multiculturalism, Ontario, Michael Ford. And let me tell you that Michael Ford was on India visit recently. I saw his pictures from Shri Darbar Sahib Amritsar Golden Temple. I was surprised to see it. It was very nice to see him. He was honored with Sropa by the local Ceremony Committee members over there. So we'll talk about that later on, but now the very, very important issue which we are going to discuss with him is that Premier Ford yesterday make a very, very big announcement along with Minister of Health that now we will have a private kind of system for not major surgeries, but hip surgery, cataract surgery or knee surgery. These kind of surgeries which people have to wait for more than 1 year, 1.5, 2 years time. So he's trying to expedite this. He gave example of his own mother who had to wait for a long, long time for her hip surgery. So many people are suffering because they don't get date for this surgery. So how this is going to work, we have to wait for more details. But whatever details Graham McGregor has, we will ask him. Graham, welcome to Radio Parvasi and good morning.
Good morning, Rajinder, and good morning to all your listeners. Thanks for having me on the show.
And we can't start show without talking to you a little bit in Punjabi because that's your trademark now. So, Sat Sri Akal and Happy New Year, Nama Saal Mubarak.
Yeah, Sat Sri Akal, Lori Dia, Lak Vidanya, Metwada, Brampton North, PC Party MLA for Brampton North. Always happy to be here on the show with my friend Rajinder.
Okay, thank you. Graham, tell us more. We broadcast live yesterday, press conference of Premier Ford. Many journalists were asking him questions, relevant questions. So he gave answers to more or less for all those questions, but still we are waiting for a lot of details. What information you have on this, then we will talk later on about that.
Yeah. So, and I really wanted to make sure that I had a chance to come on for the program because we're hearing a lot of, quite frankly, I think politically motivated misinformation out there, especially on social media.
Okay.
We're seeing the opposition is using this announcement as a chance to attack the government. I think thinking that there's some privatization agenda or American-style healthcare. I just want to be clear to listeners that that's nothing about what this announcement's about. What we're looking to do is to take a few kind of more minor procedures, starting first with cataract surgeries, and MRI, and CT scans. Eventually, we're going to expand it out to knee and hip surgeries. And we're really looking to get these patients out of the hospital into a community clinic, onto a surgeon's table, and hopefully out the door a lot faster. We're expanding using existing community sites. We're going to be expanding 14,000 more cataract surgeries, which represents about 25% of the existing wait list, as well as 49,000 hours for MRI and CT scans. Now, Minupata, Tonupata, Saranupata, for a lot of these procedures, actually the worst place for a patient to be in is actually at the hospital because, at the hospital right now, they're dealing with certainly life-threatening ailments. They're dealing with major surgeries. What we're looking to do is to get some of these surgeries out of the hospital into the clinics. But I want to be clear to everybody, every one of the listeners, that it'll only be able to bill OHIP codes. Nobody will ever have to use their credit card. You'll only be able to use your OHIP card in order to access any of these procedures. So, there's no program like pay extra money, skip the wait list or anything like that. Everybody will be receiving the same standard of care and be using their OHIP card through the Ontario Health Insurance Plan, not their own private funds.
Okay, Graham, Premier Ford already has made it very, very clear, as you said, that they will be using their OHIP card, not their credit card. This is very, very clear. There's no question about that. My question is that Premier Ford himself has, announced that around 200,000 more immigrants are settling every year in Ontario. Our federal target is close to 500,000 immigrants every year. So majority of them are settling. They want to settle in Ontario because of many, many reasons. We know that. So when we are already struggling with hallway medicine at most of the hospitals, we don't have enough family doctors, surgeons, nurses. How we are going to cope with this newest announcement?
So, thank you for bringing up the point about immigrants coming into Ontario. And it's going to be many more than 200,000 very soon. You know, the federal government target for 2025 is actually 500,000 new Canadians coming in each year. We estimate about 60% of those new Canadians are going to settle in Ontario. So that number is going to be more like 300,000 very, very quickly. And you're right. This is exactly why we need to be building more infrastructure, more capacity in the system, but also exactly why we need to be diverting some of the patients out of hospital when they could be receiving care elsewhere. So that's why we realize that the status quo on healthcare simply isn't working. It's not acceptable to continue to do the same old, and expect a different result. We're looking to be innovative and embrace changes, like moving some of these elective surgeries out of the hospital and into community clinics. You know, we estimate almost half of the surgical backlog is captured under some of these kind of smaller, more minor procedures. Now, we call these minor procedures, but when you're on a waiting list for a year, these can cause very major health problems. And actually, one of the main reasons that people immigrate to Canada, certainly part of the reason my parents immigrated to Canada 50 years ago, was because of our world-class healthcare system. But unfortunately, lately, the reality that people are facing is that the wait times that they have to go through in order to receive healthcare isn't lining up with what they expected coming into our country. So we're doing a few things. One, I want to reassure the listeners that we are building the second hospital in Brampton, Peel Memorial Hospital. We are committed to getting that done on time, on budget. We're putting in the Toronto Metropolitan University Medical School. We've got very good news coming about that very soon. So we're going to be having doctors getting trained. We're expanding nursing programs, not just in Brampton at Sheridan College, but all across Ontario. So we're adding in thousands of more nurses. And we've got hospitals going out in Mississauga. We've got hospitals all across Ontario that are being built. But we realize that, despite all this investment that we're putting into the public healthcare providers, into the hospitals, et cetera, we do need to be innovative in our approach and take advantage of some of the community resources. And the same way that somebody will be able to get a cataract surgery or eventually a knee hip surgery out of one of these clinics, it's very similar to how your family doctor's office works. Now, not everybody has a family doctor, but many Ontarians do. Imagine if every time you had to go for a checkup, you had to go to the hospital. You had to go to the Brampton Civic waiting room, or you had to go to Trillium Hospital in Mississauga. We know that getting certain types of healthcare out into community is going to drive better outcomes, and we're very motivated to drive better patient outcomes. It's one of the reasons we got elected. Many of your listeners voted for myself or for my colleagues from the PC party in the last provincial election. We got elected on a promise to make healthcare better in Ontario, and we're going to leave no stone unturned in that work to drive better outcomes and get better healthcare for you and your family.
Okay, Graham, there is another very important question. On one hand, when our federal government is inviting doctors, health professionals from all over the world, and there is a benchmark to qualify for that. There is express entry. But unfortunately, when these people come here, there is no such mechanism how we can absorb them in the system. I have shared one example recently with my listeners and a couple of other places. Recently, someone came to my house. I got term insurance, and there was a condition for my blood check and for my blood pressure, a couple of things. The guy who came, he asked me, he said, your voice looks familiar to me. So when I told him that I'm a radio host, he said, yeah, sir, I have heard your show many a times. And then I asked him, I said, what are you doing? From where you are? He said, I'm from Pakistan, and I was a pediatrician over there, a child specialist. And you know what? He is now working with DynaCare laboratory just to collect blood samples. So that is the situation. We have doctors, may not be in very big numbers from other places. Now this guy has 10 to 15 years of medical experience, but we are just wasting it. So my question to you and to Premier and to Health Minister is that why don't we absorb these people? Why don't we create a mechanism in Ontario where we can give them some kind of interest-free loan, some stipend, so that within 1 year, 2 years' time, they are ready to serve?
Yeah, and this is something that I hear about regularly. I mean, we've in my riding in Benton North, we've got a local gas station owner. Came to the country 20 years ago. He was a doctor back home, and he has to, he had to start working at a gas station. Eventually, ended up managing them, and now he's been successful in the business. But you're right. I mean, why shouldn't that same person be one of our doctors serving in the hospitals? Now, it's a complicated process that we're walking through. I will say one of the big needs we have are around nurses, and we're actually removing the Canadian work experience requirement for nurses to begin serving in Canada. And the reason for that, if you can be a nurse in Pakistan or in India or in the Philippines, there's no reason it should take you 4 years and thousands of dollars out of your own pocket to become a nurse here in Canada. So we're looking at accelerating that process. I will say we do need the federal government's partnership on this as well. There are kind of national through Canada Health standards that we need to work through with them. We need to be more targeted in the immigration that we're going to. But I think we're having a very collaborative relationship with the federal labor minister and immigration ministers and ours. We're looking to have more of a say in who comes into Ontario so that they can fill certain needs, including healthcare, but also including the skilled trades and building trades and everything else. But you're right, and I really do think, Rajinder, that this challenge of how Ontario handles and how Canada handles the increased amounts of immigration is really going to be telling for the future of our nation. Now we have a generational challenge where the baby boom generation is actually leaving the workforce right now in record numbers. So we have more people leaving the workforce than we have entering the workforce. In Ontario, our labor shortage is about 400,000 jobs across all sectors, not just on the healthcare space. And we're taking in, large numbers of immigrants in order to fill that gap. We're taking in almost the same, very similar immigration numbers that you'd see in a place like the United States, even though they're 10 times our size. They're only taking about twice the number of immigrants that we're taking. So, we need to, immigration is good, diversity is good. We need to promote acceptance and multiculturalism and tolerance, but you're absolutely bang on right. The government needs to do a better job of recognizing people's credentials when they get here. We've done it with a lot of the construction trades, plumbing, architects, electricians, removing their work experience requirements, but I think all levels of government need to work together to make sure that we're tackling the healthcare challenge. And we're certainly ready, willing, and able, but like I said, it's a process that we need to get through and something we need to work on together.
Thank you so much, Graham. BC has already taken a lead in this, and we will see how it works in BC. And as you said in the beginning that your parents came here, millions and millions of families, they have come here because of the good health system we have in Canada, in Ontario. So people come here for two reasons, which mainly I understand. Number one is good education for the kids, and number two, good health for everyone, irrespective of their caste, creed, religion, or their income, anything. So these are two best systems we have here. We have to maintain them, number one. But with the coming influx of millions and millions of immigrants in the next few years, definitely it's going to be a bigger challenge for future also. So right now we are already struggling with our health system. So Premier has taken a bold step. He's being criticized also. Let's see how this system works here in Ontario. But the question again is, we need more and more health professionals in the system. If we don't have, it's going to be very, very serious and critical situation for our province. Graham, thank you so much. We will wait for more details. You have to say anything at the end?
No, you're absolutely right. We need immigration in Ontario. We have immigrants that are coming in, but we also need to make sure that we're building for their future. And I also just want to say to your listeners, I mean, the PC party, since I've been elected, has been the most pro-growth, pro-immigration party in the Ontario legislature. We've put forward legislation not only to create more jobs, but also to invest in more hospitals and more long-term care homes. Right now we have legislation going forward and changes going forward about diverting patients away into community centers so that we're able to have better healthcare outcomes for people. We're putting policy forward to build 1.5 million homes over the next 10 years to get the supply of houses to meet our growing demand. But we do have two political parties in the Ontario legislature that have consistently opposed us at every turn. That's the NDP and the Liberal Party have opposed every pro-growth measure that our party has put forward. When we want to build more homes, they say no. When we want to invest in job creation, they say no to that. And when we're investing in healthcare, they're saying no to that. If you look at social media right now, you see the press conferences about the NDP and the Liberals about the changes we're making to expand more surgeries and expand more MRI capacity in Ontario. They're pulling out every excuse in the book to defend the status quo. I think Ontarians deserve better. We need politicians that aren't going to say the status quo is acceptable. We need politicians to stand up and say enough is enough. That's what the PC party is doing, and that's why we're taking action not only today but over the remainder of our term to make sure that we're able to grow as a society, grow as a province, and meet the healthcare needs of you and your family.
Okay.
Thank you so much for having me on the show.
Thank you so much, Graham. Before you go, I just want to add one more thing at the end. You represent Brampton North. Brampton Civic Hospital is in your riding, which is already working at its maximum capacity. It's a good news that we will be adding 200 or 250 more beds at Peel Memorial. But at this time, in Brampton, we need at least more than 800 more beds. Keeping in mind the present population of the city, I don't think when we are going to have another full-fledged big hospital, when we will be able to meet up with this demand. So we need one more big hospital, full-fledged hospital, as early as possible, Graham.
Yeah, and absolutely. You know, we know that we need to expand healthcare in Brampton, but our major priority is making sure we get the second one open, on time, on budget. You know, we mentioned it's 250 beds. It actually has room for 100 more. So eventually that will grow to 350 beds total. We're also investing in long-term care. We have some of the first culturally sensitive long-term care. Actually, in my riding, Sandalwood and Fern Forest, we have the Niwaj Campus of Care, where eventually seniors will be able to receive health care in their native tongue, in Urdu, Punjabi, Hindi. And we're also doing things like what we're doing today, which is moving services into community clinics. So, like I said, cataract surgeries, 14,000 cataract surgeries represent 25% of the waiting list. So this immediate change that we're bringing in alone is going to help us with 25% of the cataract surgery waiting list. When we expand this out to hip and knee surgeries, yes, there are challenges we have to overcome as we roll out the program. But, you know, we're looking at healthcare as a full continuum. And I would just advise, the listeners and certainly Brampton residents is something that I talk about with my own constituents all the time. Yes, we need to invest in more hospitals. We're doing that. But there's also a whole lot of other aspects of healthcare, like investing in these community clinics, giving them the tools they need to provide healthcare, like the long-term care, and like training more nurses, training more doctors, recognizing their credentials, building medical schools, which we're doing. There's a continuum of it, and we're looking at the big picture to make sure, like I said, that you and your family receive the best healthcare that you can, that Ontario continues to be a world leader when it comes to healthcare internationally, and that you and your family have the best patient outcome possible and that you deserve.
Prime Minister Justin Trudeau is meeting in February with all the premiers. Premiers are demanding more money for their provinces for health care. Prime Minister has already not committed but almost gave a positive reply to that. He said, yes, we are considering, and let's hope that Ontario gets more money from the federal government also and spend in the healthcare system here. I know many families, they go to India, they go to Pakistan for cataract surgery, for hip surgery, for knee surgery. I wish and I believe in coming days when this system starts working, if we can rapid it up, if we can increase this process, it will be wonderful for all those families who are waiting for months and for years. Graham, thank you so much for talking to us.
Thank you, Rajinder. Thanks for having me on the show.
Bye-bye. ਇਹ ਸੀ ਗ੍ਰੈਹਮ ਮੈਕਗ੍ਰੈਗਰ ਜਿਹੜੇ ਸਾਡੇ MPP ਨੇ ਬਰੈਂਪਟਨ ਨਾਰਥ ਤੋਂ ਨੋ ਡਾਊਟ ਉਹ ਕਹਿ ਰਹੇ ਨੇ ਕਿ 250 ਬੈੱਡ ਹੋਰ ਆ ਰਹੇ ਨੇ ਇੱਥੇ ਪੀਲ ਮੈਮੋਰੀਅਲ 'ਚ ਟਾਈਮ ਤੇ ਆ ਜਾਣਗੇ 5-6-7 ਸਾਲ ਲੱਗਣਗੇ ਪਤਾ ਨਹੀਂ ਕਿੰਨਾ ਕੁ ਸਮਾਂ ਲੱਗੇਗਾ ਪਰ ਅੱਜ ਦੀ ਡੇਟ ਦੇ ਵਿੱਚ 800 ਬੈੱਡ ਹੋਰ ਚਾਹੀਦੇ ਆ ਬਰੈਂਪਟਨ ਨੂੰ ਕਮ ਸੇ ਕਮ ਤਾਂ ਇਹ 800 ਬੈੱਡ ਅੱਜ ਚਾਹੀਦੇ ਆ ਤੁਸੀਂ ਸੋਚੋ ਕਿ ਆਉਣ ਵਾਲੇ ਅਗਲੇ 5-7-10 ਸਾਲਾਂ 'ਚ ਇਹ ਨੰਬਰ ਕਿੱਥੇ ਦਾ ਕਿੱਥੇ ਚਲੇ ਜਾਣਗੇ ਜਦੋਂ ਹਜ਼ਾਰਾਂ ਇਮੀਗ੍ਰੈਂਟ ਹੋਰ ਆ ਕੇ ਸੈਟਲ ਹੋਣਗੇ ਇੱਥੇ ਬਰੈਂਪਟਨ ਦੇ ਵਿੱਚ ਤੋ ਇਹ ਜਿਹੜਾ ਪ੍ਰਾਈਮ ਕੱਲ ਐਲਾਨ ਕੀਤਾ ਹੈ ਪ੍ਰੀਮੀਅਰ ਨੇ ਅੱਛਾ ਐਲਾਨ ਹੈ ਪਰ ਇਹਦੀਆਂ ਹਜੇ ਮੋਡੈਲਿਟੀਜ਼ ਨੂੰ ਡਿਟੇਲਸ ਨੂੰ ਵੇਟ ਕਰਾਂਗੇ ਇਹ ਕਿਵੇਂ ਵਰਕ ਕਰੇਗਾ ਕਿਉਂਕਿ ਜੇ ਆਲਰੇਡੀ ਹੈਲਥ ਸਿਸਟਮ ਜਿਹੜਾ ਚੱਲ ਰਿਹਾ ਹੈ ਉਹ 'ਚ ਉਸ ਨੂੰ ਡਿਸਟਰਬ ਕਰਕੇ ਇੱਕ ਨਵਾਂ ਹੈਲਥ ਸਿਸਟਮ ਬਣਾਉਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਜਾ ਰਹੀ ਹੈ how it is going to work ਹਜੇ ਦੇ ਬਾਰੇ ਬੜੇ ਲੋਕਾਂ ਨੂੰ ਕਨਫਿਊਜ਼ਨ ਹੈ ਸੋ ਲੈਟਸ ਵੇਟ ਐਂਡ ਵਾਚ ਜੁੜੇ ਹੋਏ ਹੋ ਤੁਸੀਂ ਰੇਡੀਓ ਪ੍ਰੋਗਰਾਮ ਪ੍ਰਵਾਸੀ ਦੇ ਨਾਲ